Hi everyone, this is our weekly blog, and today we'd like to talk about prepaid plans. That's what we do in our clinic. That's how we treat people. We offer them health plans anywhere from 1 month to 6 months. And so we've been asked to try to explain a little bit about how we do these prepaid plans, and they've changed over the years. Now what we do is we do what we call day zero, which is to get to know you visit. Day zero can be a 15-minute free visit to just read their pulse and to tell the patient what we think is wrong. Or it can be a 30-minute visit, which we charge $80 for, but if they pay in advance, we charge $40. That's a little bit more in depth with the patient. And then for those coming from a long distance, we do what's called a 60-minute day zero. That's $150, but we discount it to $60 if they pay in advance. So that's sort of the three ways you can come into the clinic initially, either for free, for a half hour, or for an hour. Obviously, each visit is the longer the visit, the more detailed it is to talking about their health, what they would like to accomplish, and so forth. In these visits, it becomes very obvious when you talk to the patient how enthusiastic and motivated they are to turn their health around. Sometimes patients are just, it's like looky-loos. They just are curious. Those people, we never present a plan or talk about a plan with them. What we do is we offer 3 visits so that they can see if Chinese acupuncture will work for them. These 3 visits are the first visit is a medical history visit, and then after that we do acupuncture. The medical history visit is an hour, the acupuncture is an hour. So it's a 2-hour visit. That's the first visit. The second visit is acupuncture only. The third visit is acupuncture only. It generally only takes us 1 treatment to determine how a patient will respond. So when the patient comes back for the second visit, we usually have a pretty good idea of how they respond, how they will do, and it's in the second visit that we now present our health plans to the patient. The third visit is just set up so that if we present the health plan on the second visit and they want to think about the health plan before committing to it, then they have another visit set up right away so they can go home and think about it, and then they come back for the third visit. These 3 visits are what we do if we see that the patient first doesn't know about us, never heard about us, has no feeling about us, and is just sort of curious and wants to try out if it will work or not. So we have this avenue to do that, which is those 3 visits. Those visits are called day 1, day 2, day 3. What we charge for day 1 is $150 for the medical history visit. The acupuncture is $115. So $150 plus $115 is $265. If the patient pays in advance, it's $120. So $60 for the medical history visit, $60 for the acupuncture. The second visit is acupuncture. It's supposed to be $115. We charge $60 if they pay in advance. The same for the third visit. So this is almost a 70% discount. So it's a motivation for the patient to pay in advance before their 3 visits. 3 visits are set up in 1 week. They have to do them. They can do them every day, 3 days in a row, or every other day. But we want those 3 visits completed within 1 week. Because, of course, acupuncture works on momentum, and we sort of want to see how they do. But generally, it's just designed to get the patient in quickly. Okay? And we offer such a large discount that very, very few people turn down these 3 visits. And for those people taking, if we were out of network with insurance, so we normally don't bill their insurance company for this visit, or we don't give them a super bill for these visits because they're such cheap visits. The insurance reimbursement would be negligible. Okay, so the patient's very delighted with their 70% discount, and so we never really have a problem somebody not booking the first 3 visits. So that's what we do if the patient sort of wants to try it out. If on day 0, whether it's a 15-minute, 30-minute, or 60-minute day 0, if we see that the patient knows about other patients that come here, or they came